you a new mom struggling with allergies while breastfeeding? In this video, I'm going to discuss the safety of taking Zyrtec while breastfeeding and what precautions you should take. Is it safe for a breastfeeding mother to take Zyrtec? The short answer is yes, Zyrtec can be safely taken while breastfeeding. While there are very few studies on the effects of antihistamines on nursing infants, it is expected that only a small amount would pass through breast milk to the baby. However, if you notice any adverse reactions in your child after taking Zyrtec, contact your doctor as soon as possible for advice. It's important to remember that Zyrtec should not replace your regular allergy treatment plan or other medications prescribed by your doctor. Make sure you discuss all of your options with a healthcare professional before making any changes to your medication regimen. What are the possible side effects of taking Zyrtec while breastfeeding? It is important to note that Zyrtec, also known as cetirizine, can pass through breast milk, and some infants may experience side effects from taking it. Side effects in infants may include irritability, sleepiness, or vomiting. It's especially important for moms to watch their babies for these symptoms if they have been exposed to Zyrtec via breastfeeding. If your baby does experience any of these side effects after being exposed to Zyrtec through breast milk, you should contact your doctor right away. Your doctor can help decide whether or not it is safe for you to continue taking the medication while breastfeeding. Additionally, they may be able to suggest alternative treatments that are safer for nursing mothers and their babies. Can Zyrtec pass through breast milk and affect the baby? The short answer is yes. Zyrtec does pass through breast milk and can affect the baby, but it's important to note that there isn't much scientific evidence available to determine what effect, if any, it has on infants who are exposed to the drug through their mother's breast milk. It is therefore recommended that mothers discuss the potential risks with their healthcare provider before taking this medication while breastfeeding. It should be noted that most of the research related to breastfeeding and Zyrtec has been conducted in animals rather than humans. In general, these studies have found that cetirizine, the active ingredient in Zyrtec, passes into breast milk but is not well absorbed by the infant's gastrointestinal system. Therefore, the amount of Zyrtec that would reach the infant in breast milk is thought to be very low and unlikely to cause any harm. Is there a risk of decreased milk supply associated with taking Zyrtec while breastfeeding? Research has not shown any cause and effect relationship between the use of Zyrtec cetirizine and decreased milk supply while breastfeeding. However, it is important to note that Zyrtec can pass into breast milk, meaning that your baby may be exposed to a small amount of cetirizine by nursing. Generally, though, this is considered safe for both mom and baby. If you are concerned about taking Zyrtec while breastfeeding, talk with your doctor or pediatrician about the potential risks and benefits involved in doing so. Your healthcare provider will have the best insight into how this medication might affect you and your baby's health specifically. Are there any natural remedies to help with allergy symptoms while breastfeeding? Yes, there are some natural remedies that can help with allergy symptoms while breastfeeding. One popular remedy is to increase your intake of vitamin C, which may help reduce the severity of allergic reactions by strengthening the body's immune system. Eating foods high in antioxidants like berries and citrus fruits may also provide some relief from allergy symptoms. Drinking plenty of fluids throughout the day can help keep mucous membranes hydrated, reducing their sensitivity to irritants like pollen or dust. Additionally, getting adequate rest and avoiding stress can be beneficial for both mom and baby during allergy season. Lastly, taking a daily probiotic supplement may help strengthen the digestive system and reduce inflammation that could result in adverse reactions to allergens. Are there any other medications that can be safely taken for allergy relief while breastfeeding? Yes, there are several other medications that can be safely taken for allergy relief while breastfeeding. These include non-sedating antihistamines, such as loratadine Claritin and cetirizine Zyrtec, decongestants like pseudoephedrine, and nasal sprays such as azelastine or fluticasone. Additionally, Montelukast Singulair is an asthma medication commonly prescribed to treat allergies in children that are considered safe for breastfeeding mothers. It's important to talk with your doctor first before taking any of these medications while breastfeeding. It's also important to avoid using combination medicines that contain both antihistamine and decongestant ingredients, as the decongestant can reduce your milk supply. Instead, take each of the medications separately. Additionally, some doctors may also recommend using saline nasal drops to help with congestion while breastfeeding instead of a decongestant. Is there anything else a breastfeeding mother with allergies should be aware of? Yes. It is important for a breastfeeding mother with allergies to be aware that she can still pass on her allergens to her baby through her breast milk, even if she is taking Zyrtec or other antihistamines. Therefore, it is important that mothers take extra care to avoid contact with their allergen triggers and keep their environment as clean and allergen-free as possible. This means avoiding anything that may trigger an allergic reaction in the baby, such as pet dander, dust mites, pollen, and mold spores. Additionally, since many foods can act as allergen triggers, mothers should speak with their doctor before making any major dietary changes while breastfeeding. We hope this video has been helpful in answering your questions about breastfeeding and Zyrtec. As always, it's important to talk to your doctor before taking any medications while breastfeeding. Remember that every mom's situation is different, and what works for one might not work for another when it comes to managing allergies while nursing a baby. If you have more questions or comments on the topic of breastfeeding and Zyrtec, please leave them below. And don't forget to hit subscribe if you like this video so we can continue providing information like this in the future. Thank you for watching.